Hi, my name's Joanne. I'm an academic GP working in England. I'd like to tell you a little bit about the work we're doing at SAGE to advance generalist practice. We increasingly hear people say that we need more generalists working in today's healthcare. There are a lot of descriptions of generalism out there, which results in what at times can seem a confusing array of ideas and words associated with the concept of generalism. So in this short video, we hope to address some of that confusion by clarifying, firstly, what is a medical generalist, in particular, what is their distinct expertise, and secondly, why generalist practice matters. So in essence, a medical generalist is an expert in personalised illness care. Here, we understand illness as a disruption or a potential disruption to health as a resource we need to continue in our daily lives. So personalised care is about making individually tailored decisions about what's wrong and what needs doing to address that illness, including whether medical care offers more help than harm in restoring health as a resource for daily living. This is in contrast to a medical specialist who's an expert in caring for or treating a specific disease. An example might help make this clearer. Meet Fred. He's a young man getting on with his daily life. He's got a young family, holds down a busy job. Things have been hard for a while, but they're getting tougher. He's finding it harder to keep going with his usual daily routine. He's struggling to sleep, which leaves him tired all the time. He's getting worried about pains in his back, in his knees, and now in his chest. Family and friends have suggested to him he's unwell and he should consult his doctor. And eventually, he does just that. So Fred and his family have noticed a disruption to his everyday living, which they perceive to be health-related. Fred has an illness problem. We now need to decide whether Fred's illness can or should be understood as a disease, something which needs to be treated medically. Deciding when illness needs to be understood as a disease is a key part of the generalist's expertise. We can think of the generalist as a gatekeeper between illness and disease. And we can distinguish this role from the gatekeeper role played by a GP or a family doctor who makes the decision about when a disease can be managed in primary care or needs to be referred on to a specialist. So the medical generalist will work with Fred to make a decision about what's wrong and what intervention is needed. In particular, to make a judgment about if and when medical care might help to maintain or restore Fred's ability to carry on with his daily life. So how does a medical generalist do this? How do they make individually tailored decisions? What is in the black box of an expert generalist consultation? Well, there's two things. Firstly, the generalist works using a principle of personalised decision-making, which takes a whole-person view to decide what's wrong and whether medical intervention can help, and which recognises health as a resource for daily living. Secondly, there is the practice of interpretive medicine. This is about integrating multiple sources of knowledge in an ongoing dynamic exploration and interpretation of that personal illness experience. The skills of interpretive medicine include the capacity to judge the trustworthiness of the interpretation. You can find out more about both of these aspects in our linked presentation on the website entitled The Skills of the Generalist. So generalism is a professional philosophy of practice which is deeply known to practitioners all around the world, but it's less well understood and valued by other stakeholders in the wider healthcare community. As our diagram illustrated, there are many words and ideas linked to the idea of generalist practice, which reflects that practice is complex. But recent changes in the way we organise healthcare highlight why it's important to open up this black box and help other people to understand and recognise generalist expertise. Because the distinct expertise that is the black box of generalist practice is going unrecognised and so undervalued in our current healthcare. And it's being replaced by protocol-driven decision-making, where the decision about what's wrong and what needs doing is based on a protocol which focuses on disease management rather than personalised illness care. We've described this as a technical bypass of the generalist role. And there's emerging evidence, for example from a small study we've done, that the resulting care is different, at least for some patients. By recognising and being clear about what the distinct expertise of the generalist is, we can start to clarify what the generalist is not. So the generalist is not simply a jack of all trades with an assumption of master of none. The medical generalist, by virtue of their expertise in personalised decision making in interpretive practice, is able to provide care for people with a diverse range of illness experiences. However, generalist expertise is not defined by knowing a little bit about a lot of things. Indeed, generalist practice isn't defined by what you know at all, but rather by how you use what you know, by the interpretive practice and the personalised decision making. This is the expertise of the generalist, an expertise in personalised illness care. Secondly, whilst the generalist approach lies at the heart of the philosophy of general practice and family medicine, there are other health professionals who work as medical generalists. Generalist practice is not synonymous with general practice or family medicine. In addition, certainly in the UK, GPs fulfil multiple roles in modern primary health care, including for community-based care for chronic disease, health promotion, and health service management roles, as well as an expert generalist role. Some, but not all GPs, work in the generalist capacity we've outlined here. It's important to recognise that there are growing barriers to generalist practice for many GPs, including the technical bypass we've already described. So in summary, medical generalism is expertise in personalised illness care. It's grounded in an understanding of illness affecting health as a resource for daily living. A generalist is an expert in interpretive medical practice. You can find out more about the work of SAGE on our website.